Good morning, I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients who's traveled as far from Austin, Texas. He came to Florida to Deuk Spine Institute because he had a problem with his thoracic spine. He's had pain in his thoracic spine, and I'm gonna let him tell you a little bit more about it. But I can tell you one thing, he just had surgery yesterday, the Deuk laser disc repair. How are you feeling today?
I feel amazing. The relief is incredible. It's more than I imagined.
And you were saying outside you were on the verge of crying, or you were crying yesterday because of the pain relief. Tell us about that.
It was really weird. Liz asked me what I wanted to do. I just burst out. Couldn't stop myself. It's just so amazing to have the relief. It's incredible. I never thought it would come. I've been looking for this for so long. It's been a very, very long journey to find you.
39 years, right?
35, yeah. 35 years.
Tell us about that 35 years of suffering you've gone through.
It started with lumbar cramping, muscle seizing to guard the injury that I couldn't even find. I went to countless chiropractors, neurologists, neuromuscular therapists. They took MRIs of my lumbar and said my back was great and that they couldn't help me. They had no idea why my back hurt. Finally, 5 years ago, somebody took an MRI of my thoracic, found 4 herniated discs and said, well, there's nothing we can do. Maybe in 20 years we can fuse all your vertebrae and that's it. I just wasn't willing to accept that. So I just kept looking and looking, and I found a video of you talking with one of your patients about a thoracic disc injury that you fixed. And so I called, and it was the best thing I ever did.
And then you drove here.
We flew in, but
flew here.
It was a long trip. I'm from Austin, Texas. And I looked everywhere. I was like, well, if he's doing it, somebody nearby is doing it. No, nobody is doing this but you.
That's right. We're the first in the world.
We have to fix that.
we Deuk Spine pioneered the thoracic transforaminal endoscopic Deuk laser disc repair, which is what you had done yesterday on your thoracic disc. And how do you feel today? Are you having any of that pain?
None of it. It's all gone. I had referred pain near my piriformis. I had referred pain in my heel. It's all gone in a day. I was having muscle cramping up my entire back between my shoulder blades. It was giving me headaches, and it's all gone.
How did the pain affect your life?
It was terrible. I couldn't sleep. I couldn't sit for very long. I couldn't stand for more than 5 minutes without shifting or moving. It made driving difficult. Everything, and it was going downhill. It was continually getting worse and worse. Flying on a plane was difficult just because I had to sit still for so long.
And your wife, she was worried about you all the time because you're suffering. I mean, and it's hard to do anything enjoyable together, hiking, walking, canoeing.
Yeah, I really couldn't do much of any of that. Everything was very short term because the pain would just get overwhelming.
And you're from Austin. Austin's a wonderful city.
Yeah, we have a lot of outdoor things to do.
Yeah. And so how did your pain affect your ability to enjoy nature in Austin and everything it had to offer?
We stopped going out. We literally just confined ourselves to the house, and it was all my fault. And I felt so bad for my wife, and I was tearing up our relationship because of it.
And this is what I'm talking about when I say relationship. Is people with chronic pain, they don't just miss out themselves on life, but their loved ones miss out too. Because if he can't do anything enjoyable outside because his back hurts too much, well then she can't really either, because she's going to be by his side. When you're by the side of your spouse, that means you're suffering every moment they are. So this is a new chapter in your life that you're going to open because you guys came to Deuk Spine.
Yep, I'm so excited. I'm so excited. This is amazing.
For you. And you can see actually in the surgery, we went in with a tiny little cut on his back, a couple of them, and we went into the discs and we repaired them using the laser. You could see the tears and the herniations coming out. You watched the videos after you saw the herniations coming out, and you were impressed about how big they were.
Yes.
Yeah.
They were huge.
So anything you want to say to your audience?
If you're suffering, stop. Call, get help. There is help. He can fix you. Yeah. It's amazing. And the whole staff here has been incredible. I know I was a bit of a pain in the butt when I first got here because I couldn't pinpoint exactly where the pain was coming from because it was so widespread, and you were amazingly patient.
Well, let's talk for a moment about that because you bring up a great point. The process that we went through when you got here to figure out which disc to fix. Tell us about that.
Dr. Deuk was really trying to get me to tell him exactly where it hurts. Most of my pain was coming from muscle-related cramping to guard the injury, not so much from a pinching pain at the injury. And after 35 years, my back is kind of desensitized. And so I was really having a hard time telling him exactly where the pain was at. I literally had to get my wife to put all her weight on my back so I could pinpoint exactly where it was coming from, and then she drew X's on them. Once we did that, he was able to go in with the MRI and some x-rays and find out exactly what was causing all of my pain.
More importantly, we fixed it.
You fixed it.
Without pain medications.
Right. I'm taking Tylenol right now.
Congratulations.
Thank you so much.
Happy for you guys. Enjoy yourself. Let's get you out of here.